Lordosis, kyphosis, and scoliosis refer to curvatures of the spine. Lordosis refers to the normal inward curvatures of the spine at the cervical and lumbar regions, while kyphosis refers to the normal outward curvature of the spine, specifically at the thoracic region. These terms get used interchangeably with hyperlordosis and hyperkyphosis, which means that the curves look abnormally pronounced. Finally, there's scoliosis, which always refers to the abnormal sideways curvatures of the spine. Now, the bony spine is made of vertebral bones, and there are intervertebral discs that sit between adjacent vertebrae. The spine is made of 33 vertebrae, which can be divided into 5 regions. The cervical region has 7 vertebrae, the thoracic region has 12, the lumbar region has 5, the sacral region has 5 as well, and the small tail-like coccygeal region is made up of 4 fused vertebrae. Normally, the cervical and the lumbar spines slightly curve inward. This results from the fact that the intervertebral discs in these two regions are thicker anteriorly than posteriorly, which causes this part of the spine to lean forward. On the other hand, the thoracic and the sacral spines are normally curved backward, which is normal kyphosis. Lordosis and kyphosis are typically associated with underlying conditions. For example, in osteoporosis, the bones become porous and weak and can develop compression fractures, causing the bones to collapse a little bit. This can cause a spinal deformity and can also impinge on nearby nerves. Misaligned vertebrae can also exert too much pressure on the intervertebral discs, causing them to degenerate. Other conditions like spondylolisthesis, in which a vertebrae slips out of its normal position, or conditions like Ehlers-Danlos syndrome and Marfan syndrome, where bones and connective tissues overgrow, causing spinal instability. Obesity can also put excess unbalanced weight on the spine, causing it to deform. Other causes include inflammation of the intervertebral discs, which can happen from overuse due to a sports injury or lifting weights in an inappropriate way. Lordosis typically affects the lumbar region and can specifically result from the trunk flexors and the hip extensors becoming too weak to balance the action of trunk extensors and hip flexors. When that happens, the lumbar spine gets overextended, causing it to progressively curve inwards, causing lumbar lordosis. Lordosis results in an incurved back in the cervical or lumbar spine. Kyphosis mainly affects the thoracic spine. It usually occurs when the front of the thoracic vertebrae gets deformed or crushed, causing this part of the spine to excessively bend forward. Kyphosis typically results in a rounded back in the thoracic spine, which looks like a hump in the upper back. There are a few types of kyphosis. First, there's postural kyphosis, which arises from repeated poor posture, like slouching for a long time. Postural kyphosis is most common in young females. Second, there's Scheuermann's kyphosis, which is when the vertebrae get structurally deformed and become wedge-shaped for an unclear reason. This is often associated with scoliosis, and it's referred to as kyphoscoliosis. Lastly, there's congenital kyphosis, which develops when the vertebrae get deformed during fetal development, resulting in a baby that's born with kyphosis. In general, if the condition is severe, it can reduce the space in the thoracic cavity, which can compress the heart and prevent the lungs from fully expanding. Finally, there's scoliosis, which is when the spine becomes twisted or develops a sideways curve, resembling an S or a C shape, often resulting in uneven shoulders and hips. The majority of the time, the underlying cause is unclear, and it's thought that it may be due to a defect in the composition of the intervertebral discs. These discs have a reduced amount of glycosaminoglycans, which changes their ability to act as shock absorbers, and causes the spine to become misshapen. Scoliosis is often seen in individuals with neuromuscular disorders that cause progressive muscle weakness, like cerebral palsy or muscular dystrophy. In severe scoliosis, there can be a deformity in the chest cavity, compressing the heart and the lungs, similar to what's seen in severe kyphosis. In terms of symptoms, spine deformities can cause mild to severe pain, and the stiffened spine can make it difficult to move. In severe kyphosis and scoliosis, the small thoracic cavity can lead to shortness of breath and an inability to exercise. The diagnoses for lordosis, kyphosis, and scoliosis are done by physical examination of the back. To figure out the extent of the spinal deformity, the Cobb angle can be measured. That's the measurement between two lines drawn perpendicular to the upper border of the uppermost vertebra and the lower border of the lowest vertebra involved in the curvature. In addition, radiographs of the back can be taken as well. Treatment of lordosis, kyphosis, and scoliosis typically includes physical exercises to limit the disease progression and maintain the range of motion, as well as pain medication when it's needed. For children and young adolescents, fixing braces can sometimes help prevent further spinal deformity. In rare situations, surgery may be needed. Alright, as a quick recap. Lordosis and kyphosis are usually secondary to diseases or injuries which deform the vertebrae and ligaments, such as vertebral fractures, spondylolisthesis, Ehlers-Danlos syndrome, and Marfan syndrome. Scoliosis is linked with some neuromuscular disorders like cerebral palsy or muscular dystrophy. In severe cases, lordosis, kyphosis, and scoliosis can cause back pain. And kyphosis and scoliosis may deform the chest, resulting in shortness of breath and cardiac failure. Treatment usually involves physical exercises, braces, and pain medication, or surgery in severe cases.